Tonight on the Answer Desk, millions of children will be rolling up their sleeves to get their COVID-19 vaccine, and many will be heading right to their pediatrician's office. Joining us now with more is Dr. Ohm Deshpande from Yale New Haven Health. Doctor, we appreciate you being with us tonight.
Nice to be here. Thanks, Erin.
So first question, how is Yale New Haven Health trying to get all of these shots out to the various pediatricians' offices across the state?
Well, this is something that the state and us have been planning for quite some time. We recognize that the ideal place is to really get it in pediatrician's office, although there are going to be a lot of different places where these shots are going to be available for kids who are between 5 and 11 years old. So what we've been doing for the last several weeks is really setting up a process whereby we would get all the vaccines that are ordered from the state. And, they come in really large quantities, and they're too large for most physician practices to manage. So when the practices order things, then we'll get the large quantities, we'll break them down, we'll make sure that the supplies that are needed are in there, and then we'll ship it right to the physicians' offices. And this is something we've had some practice doing as we set up our mass vaccination sites earlier in the year, as well as supporting the many different sites that we've been running within the health system over the last almost 12 months. So this is something that's critical to support our community physicians, and this is really open to any physician or any provider who is signed up with the state to vaccinate. So they certainly don't have to be part of our organization, but we're doing this as a part of our ongoing partnership with the state in support of pediatric vaccination.
Yeah, and despite this next phase of the rollout being here, we've been through this before, so we're all a little more prepared than we were. We had talked about that. There are about 280,000 children who make up the eligible population between 5 and 11. How many doses of this lower dose Pfizer vaccine do you anticipate in getting here in Connecticut?
So my understanding is that we're actually going to get just a little over 200,000 this first week across the state of Connecticut. So the actual supply of the vaccines aren't really the issue. I think and all those vaccines are simply not going to get into arms. And there are two reasons for that. Number one, I think it's really important that kids do get vaccinated, but I think there is going to be some, it'll take a little time for people to step up. Schedules are not easy, schools are in play. And then, I think people have some questions about the vaccines, and I think it's going to take some time for us to get the message out that these are just as safe as the adult vaccines. They're critically important to get into kids such that, there are no more school disruptions, and that these, the kids remain protected such that the people around them don't get the virus. So, there's definitely a lot of supply. So the timing on when people actually want to get the vaccine, that may spread things out a little bit. And the other thing is, while we are really good at getting vaccines into arms, we don't have the same kind of scale that we did have in the beginning part of the year. And frankly, a mass vaccination site, one of those huge sites that we had, may not be actually the best place for a 5-year-old to get vaccinated. So we've really been intentional about the experience that we're setting up at our Yale New Haven Health vaccination sites to make sure that it's really calibrated to the needs of pediatric patients, which are very different from the needs of adults. So, it may take some more time. Kids need some more support. We'll have therapy dogs there. So, there's a lot of stuff that is different in terms of taking care of kids relative to adults. So our children's hospital has really been an integral part of how we plan to really get these shots into very small arms.
Absolutely. Also a good time to mention that the when and the where of how to get the shot we always have on the Channel 3 app. Dr. Ohm Deshpande with Yale New Haven Health. We appreciate everything you have been doing since the start of this pandemic. Thank you so much.